Common symptoms of ear infections would include ear pain, reduced hearing, and ear discharge, sometimes accompanied by a temperature or fever. There are two types of ear infection. There's the type where a patient suffers an infection which is introduced into their nose, gets up their eustachian tube and to the space on the inside of the eardrum. And as pressure builds up in that area, the patient suffers pain and reduced hearing. And in some cases, if the infection isn't treated and if it doesn't settle on its own, the eardrum can burst. And that gives people pain, followed by discharge from the ear and resolution of pain. That is different from an otitis externa, which is an infection of the skin of the ear canal that comes in from outside, particularly common in people who have dry skin or psoriasis or eczema in their ear canals. And usually water gets into a crack in the skin, which causes local inflammation and pain and discharge at the same time. So middle ear infections come with pain first and then discharge. Ongoing discharge and pain tends to be an external ear problem. It can be difficult to work out what's going on with children when they're upset. Commonly in 2, 3, 4-year-olds, they'll hold on to their ears and they'll pull on their ears and they'll have a high temperature and be obviously upset. And that can be a clue that it's an ear problem rather than anything else. Ear infections are primarily ear problems with ear symptoms. It is possible to have discomfort in the ear and earache for a different reason. So, for example, when patients have tonsillitis or when we take out their tonsils, they sometimes wake up with sore throats and painful ears. That's referred pain to the ear, and common areas which can refer pain to the ear include the throat, or teeth, or the temporomandibular joint, which is just in front of the ear. Ear infections which come from the inside of the eardrum are treated with antibiotics primarily. Otitis externa, the infection of the skin of the ear canal, is treated by keeping the ear as dry as possible and then topical treatment, such as antibiotic and anti-inflammatory drops. In some cases where there is debris and discharge laying on the skin of the ear canal in an otitis externa, then that debris has to be removed first before the drops land on the skin of the patient and are therefore effective. The vast majority of ear infections are self-limiting or can be settled with simple treatment. Unusually, patients who have a middle ear infection can suffer complications such as mastoiditis, although I'll say again, they are quite unusual. Usually, ear infections last for a day or two before they settle and can be treated by the patient at home. Unusually, if symptoms are persisting, then advice needs to be sought. In the event that symptoms are persisting and the discomfort is severe, or if there are other symptoms that arise, such as the patient is generally unwell, or they start to notice swelling behind the ear, then it's reasonable to seek advice.